And then I started my practice and I built up my own hospital, my indoor practice, then NICU. I had one or two small branches of the hospitals also. But due to manpower, it was not possible to run all these things. Luckily, I got my son, younger son now, he is a child specialist, super specialist. His wife is also medico. And then he is now running that chain of the hospital.
Hi, everyone, and welcome to another enlightening episode of Facetime with Leaders, the podcast where we explore the journeys, insights, and wisdom of extraordinary individuals who are shaping industries and making a difference. I am Taneol, and today we are honored to have with us a true stalwart in the field of medicine and education, Dr. Shiwaji Patil. With an illustrious career spanning nearly 4 decades, Dr. Patil has made remarkable contributions as a senior consulting pediatrician, an educator, and a leader in healthcare governance. His work has not
Yeah.
only impacted countless lives in clinical care, but also inspired generations of medical students and professionals through his teaching and leadership roles. From spearheading initiatives in rural healthcare to serving on academic boards, Dr. Patil's journey is a testament to dedication, compassion, and innovation. So get ready for an inspiring conversation as we welcome the incredible Dr. Shiwaji Patil to FaceTime with Leaders. Dr. Patil, thank you so much for joining us today, and it's our privilege to have you with us. So, your career spans an incredible 4 decades, marked by remarkable achievements in healthcare, education, and leadership. We'd love to hear about your journey, how it all
Okay.
began, the challenges and milestones along the way, and what has kept you motivated and inspired throughout this extraordinary part. Could you take us through the story?
Yes, sir. Basically, I am coming from a farmer family from a very remote place of Maharashtra, Western Maharashtra. I lost my father when I was in fourth standard. My mother and my elderly brother, they took the pain for my education, my food, and everything. And being a farmer, that economical condition was very critical. I was not having even shoes or chappals before going to MBBS. On merit, I got that MBBS admission. I tried my level best. I give my 100%. I become a gold medalist of Shivaji University in Maharashtra. Then I got post graduation MD also on the merit. And with my maximum hard work and honesty, and you see good relations between my PG guides and teachers and seniors, everybody, I got that MD examination pass with the flying colors within first attempt only. Then I started my own practice. Worked for a few years for the government because I have to repay the loan of the government. Whatever I had when I was learning in the MBBS. Then that was just a small amount. It was 5,555 only. For 4.5 years, I use 4,555. That is the 555 only. But that I have to repay from Bank of India. I am very thankful to them also because at that time they have given me that big amount at that time, a 52 years ago. And now then I entered in the government job. I was a class 1 medical officer in the Maharashtra government. I work in the Konkan area, coastal area, that is the Arabian Sea nearby Goa. It's said to be a very, remote place. Even today also, it's a jungle everywhere. There, forest is there, the roads and electricity, everything is now there because last 10 years we are getting good things from Modi government and everybody we are trying. Our people are getting up and I practiced there as a government medical officer for 3 years, and then I started my own, and I enjoyed my own practice for 40 years nearby that Chiplun, that a town place in Konkan, a very developed town, a Tehsil place. And then I started my practice and I built up my own hospital, my indoor practice, then NICU. I had one or two small branches of the hospitals also. But due to manpower, it was not possible to run all these things. Luckily, I got my son, younger son now, he is a child specialist, super specialist. His wife is also medico. And then he is now running that chain of the hospital. And in spite of remaining with him, I started to teach the students in this backward area, medical college students. That's why I joined this rural medical college, B.K.L.W.R.M.C. That is the Bhakta Shrestha Kamlakar Valavalkar Pant Rural Medical College, Dervan, a taluka Chiplun, district Ratnagiri, Maharashtra. First, that is a highway, Bombay Goa highway. It's a place of. That is my in short story. I am still today. I was taking my students' examination, MD, that is postgraduate examination. I finished it and I immediately came for this meeting. That's all. But now I am very happy that I have two sons. One of my son and my daughter-in-law, they are working in Dubai as an executive engineer in the Dubai. My daughter-in-law is working with that army of the Dubai government, the UAE government, and my son is with the DEWA, that is the Dubai Electricity and Water Association. He is a project manager there. My wife is just a 10th class pass, and she is a housewife. That's all. Still today, I go to my village. I conduct OPD there for poor people without taking a single pie. Only thing that my dream is that in my native place, where that is also till today, it is a very remote area. I want to develop a small hospital for the children of that rural farmers, the siblings. But this is my dream. If I get chance, definitely I will do that because still today I was just a teacher, I was a social worker, I was a, you see, mentor for so many students. I was doing so many social things, but not practically because money is everything. No, I had no that much money because my hospital didn't repay that much so that I can do something for the society. I develop my own, my children's and everything. That's all. Is a small story of mine, a farmer, sir.
Lovely story, sir. Sir, your tenure as president and advisor of IMA and KDA reflects your
Yes.
deep commitment to advancing healthcare through leadership and advocacy. These roles must
Yes.
have offered unique opportunities to collaborate with diverse professionals and address critical healthcare challenges. How did these
Yes.
experiences shape your approach to collaboration and advocacy, and what lessons have you learned as a leader in this field?
Definitely, sir, because majority of the population of our country is the 45% the pediatric population. That is the children below 17 years. That is by before maturity, 45% the population of the pediatric. And a majority of the pediatric patients, they are having many problems of the health, nutrition, vaccination. Then you see illiteracy of the parents leading to stopping the education of the girls. Then no vaccinations, some taboos and traditions are there. Don't take the polio, it will cause some, you see, damage to the child, it will be important. This type of rumors or the traditions or beliefs, misbeliefs of these people in this Konkan backward area still today. If somebody gets that the cobra bite, they will go to the temple, they will go to masjid, but they will not go to the doctor. And they will bring the patient when the patient is almost dead. And that's what I want to improve. But in this area, I have to work hard still. Physically, mentally, I am at the age of 70 years. Now I am running 70. I work for 24 hours in the medical college. All the activities, OPD, operation theater, lectures, clinic, examinations, guests, meetings, even social work, camps, everything, even today also, energetically I run with my juniors also. That is, and I want literally our country should be get up from the health. As far as the health is concerned, we are not that much happy because our even schools they don't have the bathrooms for the girls, and they are getting a kidney problem, they are getting a urinary tract infection, they are getting urine infection, and nobody is taking pain. Now, thank to Modi ji, he is taking some, you see, initiative. They have started to build this and that for the girls in the periphery area.
True.
And this is my very small, you see, thoughts because I am a small person. It may come in true, the dream will be true, or it may not be, I don't know. But if I get a good opportunity, good platform, definitely I will do something for my small community at least. I am not that much like a Modi ji or Mother Teresa, Abdul Kalam Azad. No, no, Manmohan Singh or Pandapradhan, Atal Bihari Vajpayee. They are very big. They have done anything for the country. But we are very small citizen, middle class people. Still at our level, I think we can try our level. We can give 100% of ours. God has
Very
given
good.
so many things. God has given me. I had no even one rupee in my pocket to have a bus ticket. I used to run from my school to my residence 16 kilometer per day, every day. When I was a secondary school, there was no facility in my remote place. I have to go to the next village, big village, and every day I have to walk that distance, 16 kilometer to and fro. Now, luckily, I got everything. I'm very happy. But economically, I'm not that much, top level because I have had some many problems. Relatives, my sisters and brothers, everybody, they had some hopes from me. And I tried my level. Now they are also doing well. My wish that at this age, I can give something for my country, my people, the poor patients. That's my will and
That's
wish.
a very big thought, sir. Very big thought. So, your dedication to improving community health, particularly in rural areas, is truly commendable and reflects your deep commitment to making a difference where it's needed most. So,
Yes,
working
sir.
in such settings must have presented unique challenges from resource limitations to reaching underserved populations. Could you share some of the key obstacles you faced and how you overcame them?
Yes, sir. First thing is in our this backward area, Konkan. Now it's a little bit improving by the roads and communication, electricity, water supply, health, these units. But before 30, 40 years, when I was practicing there were no roads. With a bag, medical bag, I used to walk in the forest to attend some child or some attend some a patient. When I was a medical officer in the government, we have to run in the rains also. There were no bridges on the river. I had one incident that I had to swim that river and go to next that our destiny. That is the thing. But nowadays, it's a little bit improvement is there on the government parts. It is easy to provide the health systems, all the vaccination. We are trying 100% vaccination. That's why we have polio-free India now.
Hmm.
We have so many achievements. Now diphtheria, tetanus, whooping cough, almost all they have gone because we are giving good hygienic conditions. We are trying to give a good food by the government, or they are getting a good education. They are knowing the importance of the health. Just they want some initiative. Somebody there should be to teach them. They can try on their own. But before that, people were uneducated. They were poor. They were not having any communication with the city people. We were living in the city. I got my MBBS, I got MD from corporate city, big city like Mumbai, big city like Shalapur, Kolhapur, Sangli, Miraj. But I had opportunity due to my economical condition. I was forced to come in this area for that job to repay the bank loan. And that's why I'm here. I am very happy in this area. The people are very good. They are poor, no doubt. They are a little bit illiterate, but they are very well-hearted and they are very friendly. As a doctor, I am not repenting at all. I would be at my native place, that would have better. I am doing very well here and I am connected in such a way that people, even my students, they respect like I thank of everybody.
Perfect, sir.
Yes, sir.
Sir, your leadership in spearheading healthcare initiatives across 400 primary schools is nothing short of extraordinary. These programs must have required immense effort and vision, touching the lives of countless children and their communities. So, looking
Yeah.
ahead, what do you see as the long term impact of such initiatives on public health, and how do you think they shape the future well being of these populations?
Now, you sir, this point of that 400 school examinations, health examination of this, that got as a DDC, disease diagnostic camps. Not only myself, my one of my teacher when I was doing my MD, that Dr. Kasliwal, very big fellow from Shalapur, a corporate city. Then my senior two doctors, we were roaming through this Konkan area and visiting the schools. having the clinical check of the children. We had a small laboratory in our car, that our teacher had a car and he had a small laboratory there for the blood, urine, this and that, blood group we were doing. And 4, 5 junior doctors with our teacher. We had that 400 schools examination in Ratnagiri district, Sindhudurga district, at the boundary of the Goa. But now we have got so many facilities. We have got a road communications, vehicles, everything, even education. People are educated. I wish that I should reach at least those children. They are very poor. They don't have education to their parents also. That's why they are not knowing importance of the education. Because I know it, because I was a barefoot doctor. When I interned in MBBS college, I was driven out because I had no shoes. I will be wearing the slipper of 1.5 rupees. But at that time, this dissection hall, the dead body dissection, that we needed shoes only. First day I was driven out. But I want that poor children, they can be a doctor, they can be engineer, even they can be people like you, bureaucrat or any politicians. But they should get some opportunity, some help, some initiative. That's what I got. Luckily, God help everything. That's I wish that I can do something because my health is so good that at the age of 70, I can run up 4, 5 story building in my college without lift. My juniors say, "Arey, sir, how are you managing that? Before coming from the lift, you are on the top." That's a God's grace. I am nothing. I am not any addiction. No even tobacco, no drinks, no smoking, nothing. Even I don't go for the body soap after food. Only I have full time food, full day work, and full night nap. That's all.
Lovely, sir.
That I want to do something. But as an ordinary person, even though I am a doctor, I am a super specialist, I have got limitations of the finance side. Because only will is not important, no. You have to some weapons in your hand. You can do it. Only thinking, only dreaming is not. That is a daydreaming. I am thinking from beginning only. But before my children they become settled, I was thinking of my own. But a natural, you see, just before myself, then my children's, and then now I am thinking my society, my nation, everything. And that is a small thought of mine.
It's an inspirational thought, sir. So, what role do you think mentorship plays in shaping the next generation of medical professionals, and what approach has worked best for you as a mentor?
This is a very good question you asked me because what day today I observed in my medical college. This is a very big medical college. We got MBBS, MD, nursing college, physiotherapy college, and in 2, 3 more courses are there. Round about 700 acres that area our campus is having. But nowadays, the attitude of the students toward the teacher, toward the education, toward the study, it is not like that when I was a medical student. Because we were totally dedicated to medical study only. Now the students coming to the medical college, they are either from the affluent family or they may be a son of or daughter of a teacher, doctor, engineer. The farmers, they are coming, no doubt, but they are very rare. From remote area, they are learned then and then only they will come to medical college, engineering college, IIT college, or this bureaucrat, IAS, IPS. But at that time, when I was a primary school student, that luck and God's grace, somebody's blessing, wishes like you people, I got become a doctor. But now the medical attitude of the medical students toward the education, toward the seniors, toward the doctors and teachers, that is not that much good. I try to improve also, but sometimes it hurts because the people they are coming from a rich families and they don't hesitate to even insult the teacher. They say, "Oh, why are you giving that much advice? You give this advice to your son and your daughter." Man, that is the change in society. It is but natural, changing very fastly. Very fastly, everything changes. A small example I will give you. Even today, I get my PG teacher in front of me. I bow my head. At the age of 70, my teacher is he is residing in Nagpur in Maharashtra. and he's a 94 years old now. I met him Goa last month for a conference, international conference. As soon as he came, I had board and like this, and then I touched his feet. Everybody was watching. We were overwhelmed that still you are having that relation. But this is not possible nowadays because everything is changing very fastly.
Yeah.
I expect so many things we expect, but that don't run practically. It's theoretically we can have this and that, but practically it's a little bit difficult and impossible also.
Yeah, things have changed and people's perspective towards these
Even
things has.
people are saying, I have got one son, I have this property, that property, then why are you scolding him? Let him pass, let him fail, let him get MBBS or MD or not. Still, we have got so much big property. But when we were students, we had hand to mouth. We're not getting even on the day of the feast. We used to eat the full quota of the one day in the morning only because in evening there were no any rupee or 25 paisa in the pocket to have a plate of a bhaji or sira upit. That was the
Yeah.
condition. That everything changed. That's why the people, the students, everything is changing. Society is changing. Doctors are also changing. These changes are
True,
likely to
sir.
be happening. Okay, sir.
So, after an extraordinary career filled with impactful contributions to healthcare, education, and leadership, it's exciting to think what lies ahead. Could you share your aspirations for the future, whether it's continuing to guide the next generation, taking on new challenges in healthcare, or perhaps exploring opportunities in leadership or advocacy?
You see, exactly, I didn't got your question properly because my thoughts or my wishes, I wish that next generation, that the now students or the young doctors, they are not in the position to think when we were a doctor, young doctors, we were thinking all the way our patients and patients only. Even at a 2 o'clock in the midnight, I used to see and run the patient of a snake bite or scorpion bite because this area is snake bite and scorpion bite. They are very common in Konkan area and they are deadly poisonous. Nowadays, people are a little bit affluent and they are not thinking that much seriously. They say, Baba, we are getting bread and butter, that's enough. Let that patient go to somebody else. That I don't like, as well as I don't wish that doctor should be. When you are a doctor, you are committed to give 100% for the society. It doesn't matter you are a ill also. You have to try your level best
Yeah.
because you became a doctor. Nobody will expect that one engineer. After duty, he will go to home and he will enjoy the life also. But as a doctor, I never ever had even a honeymoon also comparatively. After my marriage, I was called upon back by the government. There is a family planning camp. You have to come back immediately. At that time, Indira Gandhi, Mrs. Indira Gandhi, she was a prime minister. And that family planning is a very tough, very fast speed. At that what time I got married, I went to the honeymoon in Mahabaleshwar, not big place, but that was not a happy. They called me back from that place, and that I happily came back. I enjoyed my duty, and that's why I am little. If I see it retrospectively, I am feeling a little bit better. Well, in my life, God gave me a chance to become a doctor from such a condition. And I tried my level. I may not be 100%, but whatever I had, mentally, physically, everything I tried. And these people now, they don't give because this is a new generation. They want bike, they want mobile, they want hi-fi clothes, everything they want. It's okay. They are lucky that parents are having it. But my parent had no food to even eat. How they could afford that bike and all the high class clothes. That was our condition. That's why the changes definition may be changed, but the principles or expectations of society may be the same. You see, this government machinery and corporate, they are both they are both important for the health of the society, health of the nation, because our government cannot afford maximum budget for the health. They give hardly 1 or 2% of the total budget. But those persons like Adani, Ambani, Birla, Tata, they have developed so good hospital. For example, late Ratanji Tata, what is that big hospital in Mumbai, Tata Cancer Hospital? It is the biggest hospital in Asia. That is why corporate people, corporate this world also important as far as the health is concerned. And for the government also, they have to cooperate with them because they have got the money, but no land. They have got everything, but no manpower. Government will supply some permissions, some certificates, this and that. In Mumbai, for a small 1 square foot, it may need thousands and thousands rupees. Government gives. For example, that Ambani Hospital, it was built by one of my classmates. He died of Nitu Mandke. He was a very cardiac surgeon. He was earning, he was putting every day 3 lakh rupees in the bank as the interest of that total loan of the hospital, 300 crore hospital. In Andheri West, that Kokilabin Ambani Hospital, now that is known as, that death of the doctor, my classmate, his wife, she was unable. She is also doctor, but anesthetic doctor, and she could not manage it. So she gave up to Ambani. Now it is a corporate, a bad thing to say you very sadly that now it's not a corporate hospital, it is a corporate hotel.
True.
Just if you go there, no place for poor person, no place for government officer, no place for a person like me or you. They will say, have you got a 1 lakh rupee to deposit with us? Then you are admitted, you are treated there.
True.
Now, that's a difference between government and corporate. Doesn't matter, government's quality may be a little bit low, but they are giving free of charge. That now Mahatma Phule scheme, Rajiv Gandhi scheme, all the poor people, they are getting lakhs of rupees. In our hospital right now, even though somebody goes for a prostate cancer, a male person, we can sanction easily 10 lakh rupees for that surgery because we are getting from the government. After all, government is also important, and the corporate people like Tataji, particularly Tataji. Now, he was a very great man. We will miss whole life, every second, every respiration, every breath. He had done so many things. We cannot do anything 1% of his also, but at least we should try it. That is the importance of government as well as corporate people.
True.
That is what I feel. I may be wrong.
No, sir. I'm making absolute sense, and you're very right that
Then
everyone, healthcare, something is basically healthcare should be available to everybody.
any cost, doesn't matter it's a corporate people or it's a government people. But that poor children or poor wives, that ladies, they will have a CA breast or CA uterus or so many things, they are a problem. Almost our 60% women and children are anemic. That is low hemoglobin, low blood level, low calcium level, low immunity. That's why they're getting a prey for any disease like a COVID, corona. They are dying of because of a good want of a good food, good sanitation, good vaccination. And that's why the government is also important because Modi Saab, they provided 3 injections of that COVID vaccine. It was costing, one injection was costing 1,800 rupees from a top company. But still, Modi ji supplied almost all people. That everybody should try, no? Not only government, corporate, even people, ordinary people like you and me also. They should think of the others.
Yeah, true, sir.
And when you are settled, you should think of others. Before settling yourself, but natural human being tendency, we will think ourselves first. But after you are okay, then you should think of the others also. That is my thing, my opinion or my thoughts.
Very rightly said. So, as a participant in Directors Institute, we'd love to hear your thoughts on how the program aligns with your goals and what aspects of it have stood out for you so far. How has your experience been, and what value do you see it bringing to the leaders in fields like yours?
Definitely, sir. Whatsoever I was observing last 1 year, every weekly I was attending that webinar. Dr. Heval Mehta, Dr. Jishan sir, Akash, now you and this fellow just before Ganesh Sham, that Hari Dasani. So many people, they are so friendly and so politely speaking. I am nowhere. I am totally new in this field because my profession is totally different. I am a doctor. Whole life I have spent in the medical. But when I am entering in this field or in this on this platform, everybody is welcoming me. Everybody is giving me guidance. Even Heval Mehta, Jishan Padan, oh, they're stalwart. They're speaking like anything. They are guiding and giving some guidance. Everything in a very proper way. So many people, that even your staff also, that Priyanka madam, then Anjali madam, then Gavina madam. Whenever I used to phone them, anybody of you, particularly everybody's staff, they are very sincere, very polite. I'm very thankful to them.
That brings us to the end of today's episode. Stay tuned for more powerful stories and invaluable advice from inspiring leaders in our next episode. Until then, please remember leadership is a journey, not a destination. Keep striving for excellence and make a meaningful impact wherever you go. Thank you so much.